I'm doing a series of videos on thyroid problems. I'm going to scoot my phone over so I can see my list. I am just trying to talk today about the various symptoms that go along with thyroid problems. And it's a long list, so I typed it up so that I could have my memory jogged here, as I don't want to forget anything. But this is just purely from memory. You can also Google symptoms of thyroid disorders, and they may give you the top 4, or they may give you 100. But this is what I see. It's about 20 or so. Just starting in no particular order, but one of the things that I see with thyroid problems is hair loss, especially in women. It often comes down to the thyroid is a problem. You can have genetic tendency for hair loss like me that doesn't have anything to do with the thyroid gland, but it's just kind of a male pattern baldness. That's different. But if you're a woman and you're starting to lose your hair, almost always it's a thyroid problem. Headaches, big problem with thyroid as a cause. Neck pain. The thyroid is located right here, by the way, in your neck. Looks like a little bow tie in ways. And it is a culprit for making the neck tight and makes the head hurt. Headaches in various times in the day, but it can make the neck kind of stiff. And it also has cause for some patients of feeling like their throat is swollen and they can't swallow very well. Just feels like their throat is kind of closing up. Not an allergy type attack, but just feels like their throat is real thick and trouble swallowing. The thyroid can also cause pain down the shoulders, and it can also cause some pain down the spine, like a very stiff spine. Shoulder pains are pretty common. I mentioned stiff back. The thyroid is very, very common for affecting moods. It can cause depression, it can also cause anxiety and panic attacks, and just general moodiness, anxiety, nervousness. The thyroid can cause chemical or hormone signals that disrupt the steady beat of the heart. So irregular heartbeats, skipped beats, almost always, in my opinion, seem to be related back to thyroid dysfunction. So you fix the thyroid, heart goes to normal. Trouble losing weight. The thyroid is the regulator of the metabolism in many ways. So if you're having trouble losing weight, you're doing a diet or exercising with no results, it's often tied back to some thyroid problems. The thyroid is very causative for constipation. The thyroid, if it's not functioning well, generally also tires out the adrenal glands. So you may think you have adrenal fatigue when in fact you may have, as the primary cause, thyroid dysfunction. It's also a big culprit with not letting you sleep. So insomnia, trouble falling asleep, trouble staying asleep, waking up after a long night's sleep but feeling like you're still exhausted. So just complete exhaustion, tiredness, sleeping 12 hours and then feeling like you could sleep another 12 hours just because you're not rested well. On the flip side, sleeping some, but you wake up very easily, can't go back to sleep. You're kind of you're not sleeping deeply. They're both controlled by the thyroid gland, in my experience. The thyroid gland is the boss of the sexual organs, so it often is tied in with low libido. So if you have a low interest in sex, it's very often the fault of the thyroid gland. So libido being low is usually a sign of, probably something's off with the thyroid gland. And also for women, fertility issues or reproductive issues, inability to get pregnant, inability to maintain a pregnancy, menstrual cycle disorders. My menstrual cycle's too heavy. My menstrual cycle's not there. My menstrual cycle is too short. I keep having a menstrual cycle every 2 weeks. That's not correct. Very often that's because the controlling mechanism for the reproductive stuff is the thyroid gland. It's the boss. Dry skin is another symptom, and that was my top 20 or so. I hope that gives you stuff to think about. Please comment, ask questions. If you know someone who's got some of those symptoms, please share this video with them so that they can see it, maybe get some light bulbs going off and get some tests run and get some help going so that they don't have to have these symptoms. That's what all of this video series is about. I'm just trying to educate for, hey, did you know that these health problems can be coming from this thing that's not tested for enough? You need to get this tested so that we can get you feeling better, or your friends or your family. So share this and stay tuned for other videos. We'll be talking kind of step by step through various topics related to thyroid dysfunction. And hit me up with some questions or comments, likes, all that good stuff, and I'll see you on another video.